بسم الله الرحمن الرحيم. المحاضرة بعنوان Diseases of Nervous System Part 1. لاحظ هذه الصور اللي موجودة في السلايد رقم 1 هو عبارة عن العديد من الحالات الابنورماليتيز نتيجة Nervous System Diseases. إذا قبل لا ندخل في أمراض الجهاز العصبي لازم نسوي refreshing للأناتومي, histology and physiology of the nervous system. Nervous system is divided into central nervous system and anatomic nervous system and peripheral nervous system. This graph showing the central nervous system, which are including the brain and the spinal cord, peripheral nervous system including somatic, sensory, skin, special sense, somatic motor, fiber to skeletal muscles, visceral sensory fibers, internal organs, and autonomic motor fibers to cardiac and smooth muscles glands, including divided into two, sympathetic and parasympathetic. Therefore, the nervous system has three main anatomic divisions. The central nervous system, brain, and the spinal cord. The peripheral nervous system contains 12 pairs of cranial and 42 pairs of spinal nerves and their ganglia, which are distributed into various organs of the body. Number 3, the autonomic nervous system contains two chains of ganglionated nerve cords extending on each side of the lower surface of the thoracic vertebral and their various branches to the soft organs of the large bodies, cavities, the meninges. These are membranes covering, while the meninges is divided into three types: dura maters, arachnoid, and biomaters. The dura maters are the thick or outermost covering. Arachnoids, العنكبوتية, it is the middle layers containing the cerebrospinal fluids, and the biomaters, it is the innermost vesicular membrane covering the brain and spinal cord. Cerebrospinal fluids, it is a structural watery material to protect the central nervous system from confusion. The brain, it is located in the cranial cavity, بالجمجمة. The basic structural units of the brain is the nerve cells or neurons. It's composed of the cerebrum, دماغ أو المخ. It is occupies the interior part of the cranial cavity. Is composed of an outer gray matter and inner core of the white matter. The function of the cerebrum is the covering both consciousness and intelligence, seats of all intellect and all evaluation acts, a special sense of light, hearing, taste, touch, and smell. Animal possess varying degrees of intelligence but lack the power of reasons. While the cerebellum, it is the suprasegmental portion of the brain. It consists of median vermis and two lateral hemispheres. Its function is to act as the central for nerves of coordination, those of semicircular canals of ears, muscles, tendon, and joints. They are concerned with the movement, body posture, and equilibrium. A serious cerebral injury may cause the brain to walk round or spine in circle. The pons, it lies between the medulla and the cerebral pedunculus. From the pons arise the sixth appendicular, the seventh facial, trigeminal, and vestibulocochlear nerves. This is the structure of the anatomy of the brain: cerebrum, spinal cord, medulla oblongata, pons, midbrain, hypothalamus, thalamus, and corpus callosum. The medulla oblongata, or MO, it is a connection between pons and spinal cord. It is the place of the origin of hypoglossal, glossopharyngeal, and vagus nerves. Respiratory and cardiovascular centers are located in the medulla, while the function of the pons and medulla oblongata are closely related to reflex centers of cardiac movement, respiration, swallowing, vomiting. For the other actions, spinal cord is extended from the medulla oblongata to the middle of the sacrum. It is divided into two basic regions: white matter which is composed of ascending and descending fiber. Gray matter is composed of nerve cells and their process. Function of the spinal cord, it controls the activities of glands, blood vessels, visceral organs, and to a degree the voluntary of skeletal muscular system. Conduction of impulse to and from the cranial nerves, they are proceeding directly from the brain through opening in the skull. They are 12 pairs. Some of them are motor, others are sensory, and still other mixed. So these are olfactory, optic nerve, oculomotor, trochlear, trigeminal, abducens, facial nerves, auditory, glossopharyngeal, vagus, spinal, accessory nerve, and the hypoglossal nerve. While the spinal nerves, it's originated from the spinal cord. Number they are number 37 pairs in ox, while it is 35 to 36 in pairs in dogs. Each nerve leaves the vertebral canals through the intervertebral foramen. It is composed of a dorsal sensory and ventral motor organs. The sympathetic or autonomic nerves, they come from the sensory nerve roots of the spinal nerves at interval communicating with us, joining these nerves with the central nervous system. They transmit stimuli to the heart, involuntary muscles, gland, blood vessels, and they conduct impulse from the viscera to the cerebrospinal system. This is the action, the name of the cranial nerve and its action, and the signs or diseases of during the dysfunction. We going to the nervous reflex. One of the important things we can look at during nervous system disease is nervous reflexes. There are three examined reflexes of central nervous system: superficial reflex, which are conjunctival reflex, perennial reflex, and pupil reflex. And number 4, a perennial reflex. This reflex is useful in cattle and horse in cases of recompense and failure to respond by the perennial reflex must be regarded as signs of serious importance. This reflex is a convenient means of testing the function of the local spinal reflex. One of the folds of the skin radiating from the sinus is bent between the forefinger and thumb. This should result in reflex contraction of the perennial muscular, causing the skin of the region to become tense. Number 5, pedial reflex is also one of the testes only recumbent animal which cannot rise or cannot stand when assessed to its feet. In cattle and horses, the reflex may be tested by stimulating the skin of the pulp of the heel with a pin. Also can be used in dog and cats. The deeper reflex is number 2. The deeper reflex is musculotendon reflex. These reflexes are confined to cases of recumbent animal to investigate the states of the neuromuscular mechanism or cases in which damage to the spinal cord is suspected. Patellar reflex and tarsal reflex. Number 3, organic reflex. It is respiration, including respiratory reflex, degulation reflex, defecation reflex, and obturation reflex. The common causes of neurological diseases can be divided into nutritional disorder, including polyencephalomania, cerebral ataxia, neurological disorder, peripheral nerve disorders such as vitamin B deficiency, B1, B26, B12, and decreasing vascular problems. Ingestion of algae or spoiled food may produce botulism. Number 3, poisonous plants also can be. Some plants is poisonous and causing neurological disorder. Number 4, neurotoxicants such as lead, chlorinated hydrocarbon, organophosphorus, and infectious diseases. And the best example is rabies, tetanus, distemper, listeriosis, toxoplasma encephalitis virus, or infective disease as looping canine distemper, cerebral form of babesiosis and trypanosomiasis. Parasites such as migration through brain, spinal cord, causing neuroparalytic disorders such as viral larvae, migrant toxicara, canis hypoderma bovis, larvae of stress of Stinia multisepse of the dog, and strongylus and sulistoma, and dirophilaria, causing damage of the brain tissue. Number 7, vaccine or immunization such as rabies, distemper vaccine, and metabolic disease such as hypocalcemia, hypomagnesemia, ketosis, hypoglycemia, pregnancy toxemia, also hypoglycemia. The clinical approach for the nervous system examination, including case history, feeding environment, inspection from the distance should be made from virus angles. All bodies parts of the animals starting, we have to look for the behavior of the animal, response of the animal to external stimuli, clinical signs like occupancy, a large head, dilated pupils, aggressiveness, and such as. We have to look for the also posture of the animals. Abnormal posture may rise from the injury of musculoskeletal or nervous system. Animal adapt different type of posture such as dog sitting posture in horses. Paresis or paralysis of one leg is caused by peripheral nerve injury. Paraplegia is indicative of spinal cord involvement. Hemiplegia suggests brain lesion. Also, we have to look for the gait. Abnormalities in gaits are observed when the animal walks or runs. A brain lesion may cause circling, vestibular lesion causing circling in a closed circle, cerebral lesion causing dysmetria caused by uncoordinated gait with wide part breaks whose stepping مثل خطوات البطة. Standing or walking in one size is seen in small animals due to cerebral affection. We have to also to do the palpation of the part, examination by palpation, and also we have to look the sensitivity of the animal. Such as sensitivity may be dimension hyperesthesia or hyperesthesia, hyper or hypoesthesia. Sensory reflex, it includes analgesic, loss of facial reflex, hypersensitivity, acetonemia, hypomagnesemia, tetanus, so hyperesthesia skin to the touch. While the sensory motor reflex include anal reflex, tail reflex, panniculus reflex, which is include pinprick to different region cause panniculus muscles movement along with skin twitching. Also, myotonic reflex, patellar reflex, when patellar tendon is tapped with percussion hammer, the staple joint is extended. Loss of patellar reflex indicate number 4-6 spinal lesion. Tendon reflex, reflexor reflex, when a stimulus is applied near leg, the leg is reflex. Inhibition of the reflex in foreleg will indicate lesion in between cervical 4 and thoracic 2 spinal segments, and such inhibition in hind leg will indicate lesion between lumbar 5 to sacral 2 spinal segments. Also, we have to look for the motor irritation, which is called hyperkinesia or حركة زائدة. It denotes involuntary excessive movements caused by irritants lesion of spinal, pyramidal, extrapyramidal, and motor region of central nervous system. These movement by fibrillation, spasm, convulsion, tremor, tetani, force movement, and coherence. Fibrillation, isolated contraction of virus muscle fiber. It is known as fibrillary contraction. It is observed in any stimulation of peripheral motor neuron. While we have to look for the body reflex, reflex condition may be areflexia لا توجد أي منعكس, hyporeflexia قليلة, and hyperreflexia increased response in cases of paresis. Types of reflexes may be organic reflex, respiratory reflex, deglutition reflex. Reflexes may be superficial reflex, conjunctival reflex, corneal reflex, and popular reflex by source of light in dark room, light directed to the eye. Pupillary construction occurs. Deep reflex, pedal reflex, cranial reflex, peritoneal, such as it contracts peritoneal muscles, and tarsal reflex in dogs. Index response is just to retract the finger. It is indicated if recompense accompanied by trauma of spinal cord or not. The general manifestation of diseases of nervous system. Number 1, mental status. Mania occurs, and frenzy. Mania and frenzy are manifestation of general excitation of the cerebral cortex, while Depressive mental states include somnolence, lassitude, syncope, coma. They are all manifestation of depression of cerebral cortical function in various degree. هي depressing الضغط على الرأس من العلامات المهمة. والحيوان يسوي pushing للهاند مالته for fixed objects، وتعتبر هذه combination of headache and mania. Involuntary movements, they include convulsion and tremor. Convulsion always originate in cerebral cortex, but a primary cause may be a dysfunction in system other than the nervous system. A true tonic convulsion occur in strychnine poisoning and in tetanus. Convulsion may occur in various intoxication, lead, arsenic, mercurial, phosphates, chlorinated hydrocarbon. Posture and gaits, head pressing or rotation, dog sitting posture, dropping of lips, eyelids, air, or are examples. While the paralysis, الشلل, a loss of motor power or sensation both in case of nerve injury resulting in loss of voluntary muscular movement. Paresis or نسميها relaxation, the power of contraction is weaker than normal. It may be local or general. While the systematic classification, there are a classification for paralysis. Spastic paralysis, flaccid paralysis, and the type of paralysis is often indicative of the size of the lesion. Most paralysis seen in farm animals is flaccid and is caused by lesion in the spinal cord, not in the brain. Clinical classification of paralysis, we can divide it into monoplegia, diplegia, hemiplegia, quadriplegia, paraplegia, and each one has specific definitions, such as monoplegia paralysis in one limb or one muscles. Diplegia similar bilateral paralysis جهتين. Hemiplegia paralysis in one side of the body، جزء واحد جانب واحد من الجسم الأمامي والخلفي. Quadriplegia paralysis of all four legs. Paraplegia paralysis of the posterior. Paraplegia only the posterior part of the body of the hind legs due to spinal cord infection. There are two types of paraplegia. Paraplegia in extension due to hypertonicity of the extensor group of muscles, and paraplegia in flexion due to increased tone of the flexor group of muscles. The second thing we have to know is peripheral nerve paralysis. It includes suprascapular brachial plexus and radial nerves of the forelimbs, as well as femoral, abductor, tibial, peroneal, and sciatic nerves of the hind limbs. Disturbance in sensation, lesion of the peripheral sensory neuron cause hyper or hyposensation of the area supplied by the nerve. The principal treatment of the nervous system including the following: treatment of the disease of the nervous system means treatment of the real cause, particular problem because of the failure of nervous system, because of the impermeability. We have two things we have to think about the nervous system. The failure of nervous tissue in the brain and the spinal cord to regenerate, and because the impermeability of the blood-brain barrier to many drugs. When peripheral nerves are severed, regeneration occurs if damage is not extensive. When neurons are destroyed in the brain and the spinal cord, no regeneration occurs, and the provision of nervous stimulants have no effects on the loss of function that occurs. The emphasis in the treatment disease of nervous system must be on prevention of further damage. Control of infection by a broad spectrum antibiotic, chloramphenicol, can permeable for the nervous system. Treatment of the disease of the brain is limited by the existence of the blood-brain barriers, which prevents penetration of some substance into the nervous system. The cerebrospinal fluid is property of little importance as a means of bringing antibacterial drugs to brain tissue. Decompression, increased intracranial pressure properly occurs in most cases of inflammation of the brain, acute cerebral edema, and hypovitaminosis A. In these circumstances, some treatment should be given with withdrawal of fluids from the brain tissue and reduce the pressure. The injection of hypertonic solution of glucose saline or saccharose diuretics give good but transiently results. Cerebrospinal stimulants we have to give also, and we have to give some in some cases, and in other cases we have to give some cerebrospinal depressants. Diseases of nervous system may be organic or functional. Thank you very much.